Hi, I'm Straty Righellis, an orthodontist in Oakland, California in the greater San Francisco Bay Area. While we were sheltering in place over the last few months, I had the opportunity of taking over 45 years of my teaching material and organizing it into 4 areas: diagnostic planning, treatment mechanics, interdisciplinary care, and practice development. And the most striking element of this procedure that I went through to organize the teaching material was the incredible influence that Dr. Ronald Roth had on my career. When reviewing my cases, my presentations, and reorganizing them, his footprint was on every aspect of the cases I presented. When I was a young orthodontist, Dr. Roth was one of my instructors, and I was immediately gravitated to his purpose and passion in orthodontics. It was captivating. About 15 years later, I took his 2-year course with his co-teacher, Dr. Bob Williams. And together with Dr. Ronald Roth and Dr. Williams, I focused in on diagnosis and treatment goal setting. And from that point forward, my practice changed forever. As I look back at my practice career and the changes I've made, yes, goal-driven orthodontics has modified because of innovative technology, things we've learned and grown upon. And as a result, what we're learning and doing now is so different than what we did 20 years ago. Now, of course, the teaching is through the FACE teaching group, Functional and Cosmetic Excellence, as led by Dr. Domingo Martin. It's through his teachings and his students that we are now being able to grow upon the goals that Dr. Roth taught us, and using innovative technologies, continue to grow beyond that. There's 2 points that I want to share with you. Number 1, if you've taken the FACE course and you're following the discipline that was taught, keep it up, congratulations. Your patients are going to be forever thankful and grateful for what you have learned, and your practice will continue to flourish. However, if you've taken the FACE course and have wavered a little bit, I urge you to get back on center. You'll begin to see it in your case outcomes if you don't get back on center. It's easy to wander. I encourage you to take refresher courses that are offered to get you back on center so that your patients will continue to thrive and prosper, as will your practice. One final note. The effects of the teachings of Dr. Roth and what we've learned through the FACE teaching group, the effect it's had on my private practice. There are very few practices that have been in existence for the 45 years that mine has that has grown every single year. And I owe it in part to the teachings of Dr. Roth and the FACE teaching outline. The goal-directed, driven practice is a practice that has allowed us to thrive year after year after year. And for that, I'm forever grateful. And you will be too. Thanks for your attention.